Good evening to all of audible അല്ലേ? Is it audible, all of you? Because of the technical error, we couldn't complete the webinar yesterday. So today we are going to restart the whole webinar. So Dr. Jidesh, as you all know, is a senior medical officer with Kottayam Ayurveda. He's going to talk to us regarding the Rasasastra medicines, special reference to Kottayam Ayurveda medicines. So over to Jidesh. And first of all, welcome Jidesh on board. Please start the PowerPoint presentation.
A warm good evening to one and all. So this seems to be a postponed or rescheduled presentation, which has been rescheduled from last night because of some connectivity issue. So later on, anyway, without wasting much time, and I will just have a brush up to the portion where we have dealt last night. And later, then we will go into detail. So regarding the clinical Rasasastra, so before going to, always, it's not possible to remember. There is some difference in the prescription, in prescribing this Rasa drugs in comparison with the other herbal tradition. It's not, we know that, we are prescribing most of our medicines by learning or by hearting the quotation or slokas from the classical text in case of herbal drugs. But it may not be possible in the case of mineral drugs or herbomineral drugs in all time. Because we know, just if we take the example of Sajrati or Dhanundaram or any other some kind of decoction, this kwadhas or churnas, etc. We can find out maximum 3 or 4 different references with different ingredients. But in case of this Rasa drugs, there are many different number of different medicines with the different formulations also. So for example, if you take the example of Agnikumara Rasa, which is the most common one, we can find out 51 different references with different ingredients in different contexts. At the same time, and in case of, if we consider this Lakshmi Vilasa Rasa or Mrityunjaya Rasa, etc. The Lakshmi Vilasa Rasa, we can find out more than 10 kind of different references. There is a Mahalakshmi Vilasa, there is a Madhyama or Naradiya or Laguri, etc. It's the same in case of Mrityunjaya Rasa also. So always, it's not possible to learn the sloka, or it's not possible to, it will not be a wise decision to prescribe this, that I will prescribe this medicine only after learning these quotations. It may not be possible because but one thing what we can do is, the only one thing, we can do some exercises and we can do some homework before start prescribing this kind of medicines. So always what we can do is, we have to remember the chief ingredient of or the main ingredient of the formulation what we are prescribing. And the second one is the most toxic ingredient, and its adverse effect are supposed to be known. Most of the time, or many times, the chief ingredient may not be the maximum, the ingredient which has got maximum toxicity. There will be some other hidden medicine, hidden ingredients. Maybe they might have been added with the lesser quantity. And these two are supposed to be known by every practitioner. And antidote of the main ingredient is also better if we could remember that the toxicity as well as their antidote. And the Bhavana Dravya, the chief ingredient most toxic ingredient as well as the bhavana dravya and this dose and anupana. We know that the prescription, the dose of the rasa medicine or herbal mineral drugs are quite precise and quite lesser, and the anupana is also, because they are all highly, the indication becomes highly variable as per the anupanas adjuncts what we are using. So the, while prescribing the medicines, we should be very specific in dose as well as anupana. It can be changed according to the conditions, according to the age, according to the situation, according to the seasons, etc. In case of bhavana dravya, in the most cases, we know that these are all toxic ingredients. And in most of the cases, this kind of toxic in the bhavana will be done bhavana with another kind of this toxic herbal ingredients like langali or the langali surasa or the datura surasa or karaskara, etc. So always, if we don't know the proper what is the bhavana dravya, we cannot differentiate whether the reaction or the adverse drug reaction occurred is from the mineral part or from the herbal part. So always it's better to remember these 5 points before start prescribing the rasa drugs. So the thing is, now there is another issue. So how to identify which is the most toxic ingredient? It's not possible to learn the entire theoretical part of this rasa shastra. So always just we need a capsule form. So we'll just have a classification of rasa dravya. We might have learned another classification in our UG time, like this Maharasa, Uparasa, Sadharana Rasa, etc. But such a classification is not necessary in case of especially in case of practice or clinics. So it should be classified according to it's a clinician's purview. So it's quite easy. So we will just see what are the groups which has got maximum toxicity, the moderate toxicity, and least toxicity. So if we are aware of this slide, what I feel is the 50% of the adverse drug reactions can be prevented. The first one is less toxic. We know these medicines like Sringa, Pravala, Shuktika, Shankha, Varatika, or like the medicines which has Yesada, etc., which is the least toxic ingredients and which can be used freely or without much considering the reactions. And the second one, the medium toxic, should be used cautiously. This can be produced. There can be some side effects if the dose or this anupana or the purificatory methods, etc., are not proper. So this kind of group, also we should be a little bit familiar with. So the medicines like Tankana, Navasara, Kasisa, this Abhraka, Loha, Kanta, Sornamakshika, etc. comes under this group. And the last one is the most toxic group that we should face this or we should use this with utmost care. The mercury and the other ores of mercury like Girisintura, Hinkula, Rasakarpura, Savira, etc. And the other one, this Haridala and Manasila, Gauri Pasha. These three are the most common drugs. This mercury, Haridala, Manasila, and Gauri Pashana are the most common ingredients in many of the combinations. And these are the most toxic ingredients also. And then the Mrudarasanga, Naga, Vanga, etc. also should be taken with utmost care. The medicines which contain these ingredients should be handled cautiously. And in case of the side effect with that, we should know whether the disease due to the any kind of adverse drug reaction is due to the ingredient or this mineral drug or due to our wrong prescription. So for that purpose, the common side effects has to be classified again into 3. So we can categorize the symptoms or the disease which can produce due to the ingredients of these mineral drugs into 3. The one is the mercurial group. The second one is the aconitum group. And the third one is the arsenic group. So this aconitum group and arsenic group exhibit the same kind of symptoms. The most common symptoms that evolved from these 2 groups are something like the symptoms like neuropathy. It may be numbness, tingling sensation, burning sensation all over the body, especially the oral cavity, etc. We can differentiate this from monitoring the blood pressure of the patient. In case of aconitum group, there will be the hypotension as well as this. In case of arsenic group, there will be the hypertension. So it can be the same, even though the symptoms are similar. From the presence of this high blood pressure, or low blood pressure, we can just differentiate whether it can be due to aconitum or it can be due to the arsenic. But in case of mercury, the most common symptom will be the delirium and the burning sensation, and there's complete burning sensation. And the third one is high-grade fever, which is being increased day by day or hour by hour. And basically, we can consider this as the symptoms. We can compare the symptoms which is produced due to the mercurial symptoms. Mercury can be compared with the symptoms of Pitta. We know the symptoms of Pitta. That is Yugavat Vyaptirangana, Pralaba, Kaduvatrata, Nasasya Paka, Shitecha, Brahmo, Murcha, Madhuarati. Again, these are all the symptoms, the burning sensation of the buccal cavity, the tongue, and the murcha, the delirium, etc. Vitsamsam, Pittavamana, Rektashtivanam, Amlakam, etc. Rektakotam, like the different kinds of petachia or hemorrhage, etc. are also common with this mercury. So we will just see and then what are the antidote that also we should be aware. In case of aconitum group, we can make use of this tankana as an antidote. And in case of arsenic group, we can consider this Kushmandaswarasa, Navanita, and this Ardragaswarasa, etc. as an antidote. In case of mercury, we can consider this Gandhaka as an antidote, but still that may not be sufficient. And Acharyas asked to follow the Pitta Chikitsa. He explained clearly as Rasadahe Pishak Sarva Pitta Jwara Chikitsa. So now we will see, we are aware of the toxicity range of drugs and the symptoms.
Lights are not moving.
And,
As I said, we go tomorrow.
So now
Or
we
he'll call up.
directly go to the topics. So this is a case, or not a single case. These are all 4 cases with venous ulcer from the site of that medial malleolus or that malleolar site, as well as the feet and etc. Just we can diagnose this easily as venous ulcer. And the surroundings, like the discoloration of the surrounding, that hyperpigmentation of the surrounding, and the crust formation, etc., suggests the presence of deep vein thrombosis also. So the treatment followed here, what could be what medicine or what Rasa drugs we can make use in this case, in this condition. So these are all 4 different cases with the venous ulcer with the presence of deep vein thrombosis. So how to approach this case? And I'm not going in detail regarding the herbal, but we will just go to the Saprapti. It's not a theoretical exercise. Yes, but you know that the Samprapti Vikana is the chicken. So for selecting the apt drug, we need to know what are the factors involved in the Samprapti. So of course, we may feel that it is an Agantuja. Yes, definitely it's an Agantuja pronoun. Later, as the disease progresses, the dosha dushti also has been occurred. And we can consider this Vyanavada as Vyana is the one which is circulation. As we know that Vyanena Rasadhaduhi Vikshepoti Karmani Yugabat Sarvadoja Sramdehe Vikshipyade Sada. And being skin is the manifested area, this we can consider this the other associated doshas like Prajaka Pitta as well as Avalambaka Kapha. The Dushyasa, Rasa, Rekta and Mamsa. And the Srodas, Rasavaha, Srodas and Rektavaha and Mamsava Srodas are involved. And the initial pathology, we know this, the basic pathologies are Sangha, Vimargagamana, etc. But initially, Adipravritti Sangova, it says like that. So here there is no Adipravritti, but the Sangha becomes the main pathology in the initial phase, and later there happens this Vimargagamana also. So what could be the Samprapti? So due to the Nidana, especially this Agantuja Nidana, that when the next happens as Aganturan Vedi Nijambikara, there happens the Vyanavata Dushti, leads to the proper Sroto Dushti. Initially, which happens as Sangam, and later it proceeds to progress to Vimargagamana and happens the manifestation of the disease. So here, how to approach the medicine, how to approach the treatment, and what medicine should be used here. So usually the herbal part, we can make use of this Raswanadi or Chirivilladi, etc. Because what are the properties we need to have this is a medicine here? What are the properties with the medicine should possess? There is a Srotarotha here. There is a Sangha here. So we need to dislodge the Sangha from the site. We need to restore the circulation. We need to restore the impaired microcirculation to the site. Then only it is possible to heal. We can make this the wound healed. So, what are the properties that explained in our classics to remove this Sangha? One is Sukshma Guna. The first one, the important one is Sukshma Guna. Dehasya Sukshma Chidreshu Vishadyet Sukshma Muchire Tadyatha Sainthavam Kshaudram Nimbadailam Rubutho. So the property of the drug which can enter into the channels of the body and which has got the property to cleanse that channels or srotas are called as Sukshma. So it should be Lekhu, it should be Sukshma, and it should have the property to dislodge or to disintegrate the clot, as the DVT, as the deep vein, there is the basic pathology is deep vein thrombosis. So it should possess Kadurasa Pradhana. Kadurasa has got the properties to break down the Rektaskanta. So the basic drug Rasa Sindhura has been considered. We can consider here. We know this Rasa Sindhura is Yogavahi, as well as Sukshma, and then Lakhu and Ruksha. And the properties of this drug highly variable according to the Anupanas use. Or we can say it's in another words that this medicine is augmented by the Anupanas which is being used. So this initially for removing the Srotorotha to impart with this Sukshma Guna. So we can consider this Rasa Sindhura. We can consider as with the Rasa Sindhura which has got the Lekhu Guna and Yogavahi property, along with the Anupanas like Tadyatha Sainthavam Kshaudram Nimbadailam and Rupurthavam. The Rubutaila, that is Erandathaila, which has got the Sukshma Guna as well as Shobhara. And the another Sukshma Guna that is Sainthava. So we can use this either 125 to 200 milligram of this Resacintura or 1 to 2 capsules of this Resacintura with 1 or 2 grams of Sainthava and 1 or 2 ml of any kind of processed Erandathaila in the initial phase. What are the properties what we are expecting with this protocol? We have to expect that the Srotorodha has been relieved from that area and the circulation has been restored properly. So how can we understand whether the Srotorodha has been relieved and the circulation has been restored? One thing is the temperature difference from the other. It has to be the temperature has to be compared with the other healthy site. And here previously there will be the difference in temperature, whereas in the periphery of the, especially the surrounding of the wound and the adjacent areas. By using this medicine for a period of 1 or 2 weeks, or maybe 2 to 4 weeks, initially the first symptom what we can expect is the normalization or the equalization of the temperature for the non-affected area as well as the affected part. And the second one is the discoloration, the restoration of the normal color of that area. And that improves, that indicates the improvement of this microcirculation. And once these phases are obtained, that indicates this is the phase, this is the time to change the medicine. So how to change the medicine or where to change, when to change the medicine, that also is important. The same medicines cannot be continued from the starting to end. According to the specific conditions or the specific symptoms exhibited by the patient, that the medicine has to be changed, the anupanas can be changed, or even the therapies also can be changed. So the stage is very important. Where to start, where to shift from one stage to another stage. So here, now once these symptoms are being obtained, once these symptoms are have been relieved. So again, there is no use in giving the same kind of the medicines with the same properties. So now it's a time to change. Now we need to incorporate the medicines with Vranashodhana as well as Vranaropana. So here again, the parent drug, Resacintura, alone is sufficient, but we can get better result with any kind of other by changing these adjuncts like anupanas. Maybe with the honey, probably the madhu will be the best option in this case, as we know this Vranashodhana Santhanam. Honey has got a specific property which is Vranashodhana and Vranasanthana. So either we can make use of these initial phases if once that Vranashodhana has been occurred. For this Vranaropana, we can use this Resacintura with the same dose along with the honey. And if needed, we can use some kind of kritas with the properties of Ropana. If the condition of Kritapana is, if the patient meets the condition of Kritapana, that we have to receive or we have to fetch from the Jurajigilsa, that is Kashaya Pana Padhyana Dashaheri Dilikhita. So if he fulfills that criteria, here maybe this can be augmented with this Resacintura can be augmented with a small amount of Krita also along with the honey. Where we can, what are the benefits what we can get here, we expect here. In the previous phase, it was the restoration of the microcirculation as well as the Srotoshodhana. Here we are expecting this Vranashodhana as well as Vranaropana. So this is how we can use the same drug with different conditions, with different anupanas in different conditions. We will just see that. In the later phase, we can use these medicines as rasayana. And another issue what we are going to face is the lesions will be healed with this kind of protocol. The lesion will be healed properly. And there is another issue that we have to forecast. The healed area will be highly rough, and probably there will be that area will be itching so much, and so the patient will have a tendency to itch there continuously, and which creates the formation of wound again. So to prevent that, we can moist that area by applying the medicines with like this Etiopathogenesis externally. This is for moisturizing that area. So this Etiopathogenesis, we know that it's a zinc oxide. Zinc compound is nothing but it's a calamine. So we can get the same kind of action of this applying calamine lotion over that area by this Etiopathogenesis also. This can be made as into an emulsion by mixing with any kind of ghritas, probably this Tiktaka ghruta or Shatatavada ghruta, etc. can be used for the external application. And so maybe Etiopathogenesis capsule, 2 or 3 capsules has to be taken out, and that powder can be taken to a palm, and it can be mixed with Shatatavada ghruta and can be applied over that area, which helps to keep that area moist, and thereby we can prevent the disease. So this is what how Rasa Sindhura can be used in different conditions with different advantages. So this is a case where we will just see this Rasa Sindhura in little bit detail. We know that it's a Kupipakwa Rasayana. The basic ingredient, Rasa Sindhura is used as basic ingredient in many other combinations also. And it has got an active, it can serve as an active drug and also a catalyst to the other drugs of the combination because of the Yogavahi property. You know that ingredients are just 2, Parada and Gandhaka. Now, we will just see some of the interesting Anupanas. See, if we are seeing the text of the Shastra, there are some chapters itself which has been dealt with the Anupana of Rasa Sindhura. So you can see some of the indication of the Rasa Sindhura with the different Anupanas. In Jwara, the better and the specific Anupana mentioned here is Jiraga and Pipali Churna. In case of Sannipada Jwara, there is Rasa Sindhura with the Narkundi Surasa. See, in case of Aruji, with Rasa Sindhura with the Madhuranga Surasa. In case of Chardi, Rasa Sindhura with the Laja Churna. In case of Apasmara, in case of that is Rasa Sindhura with the Kalyanaka Krita. In case of different kinds of Kushtha, Rasa Sindhura with the Khadirakvat. In case of different kinds of Vadavyati, Mamsa Yusha or Taila or Lesuna. In case of Vadarekta, Kokilaksha or Ikshurasa. Shukravruddhi, Rasa Sindhura can be given with the Kadali Phala, Churna or Kwatha, as well as Swarasa, as well as Ikshurasa. So can you find out any common factors in these? So there is an interesting factor that so most of the cases in the left side are the agraushadha of the disease mentioned in the right side. So what we can use the same principle we can extrapolate into the other disease also. So just if we know the agraushadhas mentioned in the Agrasangrahaniya chapter, so we can select those Anupana and we can add this with Rasa Sindhura to augment the action of the Anupana. So Rasa Sindhura mixed with Agraushadha becomes more potent combination than the other one. So this is how we can just select the medicines. Just select the Anupanas. So we will just see the another case. Previously, it was all the previous cases were Rasa Sindhura, the venous ulcer with the DVT. But in this case, you can see this is the case of venous ulcer without DVT. You can see this, the lesion is, there is no hypopigmentation over the site or the periphery of the wound, and the formation of esker formation is also available. It's seen, you can see there, and the wound is also in a healing stage. So here we can directly go to the second phase of the treatment, which I have, second phase of the combination, which I have mentioned before this session today. Previously, I was mentioned in the first phase, in the previous case, it was mentioned that in the initial phases, this resisindura can be mixed with the Erandathaila as well as Sainthava, and then to shift to Ghrida and Madhu. Here in this case, we can directly start with resisindura plus Madhu as an anupana, as there is no need of the Sukshma Guna or Sroto Shodhana here. Directly, the action what we need here is the Shodhana, Pranashodhana and Ropana. So this is how we can select the differentiation. And technically or chemically speaking, both this resisindura and hingula are mercuric sulfide only. And if we analyze the microstructure or nanostructure, we can find out some difference. But basically, according to our therapeutics, the indications are different. As resisindura is the one which is being prepared as Kupi Pakwa, it becomes more Lakhu as well as Sukshma and Yogavahi. At the same time, this Hingula, which is not in a Bhasma form, and it doesn't have much Agni Samparka, the contact with the fire, in comparison with the resisindura. This is more comparatively more Guru, and the properties like Shodhana or Vrana Ropana, etc. are comparatively less. So the Laghutva becomes the main factor in which clinically we can differentiate with this resisindura and Hingula, even though both are structurally same. Now we will just see another case. So a female aged 40 years complains of recurrent, extremely painful lumps on underarm. These lumps are often burst out with slimy fluid leakages. And once that boil has been burst out, up to 1 week or 10 days, there will not be any other format, any issues for this. And once again, the same issue will be repeated maybe after 10 days or 14 days. Many a time, the excision has been done. And even though how much we exercise, again, the same issue was repeating. So what could be the diagnosis? From the site as well as from the nature of the disease, we can diagnose this as the case of hydradenitis suppurativa. So there are some different causes. We know that explained in the text: the plugged apocrine glands, androgen dysfunction, and hyperhidrosis, excessive sweating, and even some genetic factors. And moreover that, the obesity. So obesity becomes the central factor, and all other as the supporting factors. So how to, according to, for making our own, or for selecting our medicine, we need to decode this samprapti or the etiopathogenesis to our own samprapti. So what could be the samprapti of this disease according to us, according to Ayurveda? Then only we can select the medicines properly, precisely. We have to consider this as Pitaka only, Prameha Pitaka. But there is a reference that can a Pitaka or can a Prameha Pitaka happen even without Prameha also? Yes, it can happen. Pramehena vina peda jayande dushtamedasa. So there are two sets of pathology. the disease is a deep-rooted pitaka only. The first one is the prameha samprapti. And from prameha samprapti, the medodushti or the pitaka or granthi happens. And later it goes as progress as nadi vrana. And the another one, the second line, the second samprapti is pramehena vina peda jayante dushtamedasa. High amount of medodushti alone is sufficient, is capable in the formation of this medicine, formation of this kind of pathology. So because of this medodushti, again there will be the srotorodha proper again. And from this srotorodha, there will be the localized settlement, localized lodging of these medas or the other tissues. And initially this manifests as a pitaka. And because of the continuous bursting or continuous excision, this intrudes in more deeper to the tissues, and finally it develops into a nadi vrana. So again, what should be our line? So previously, the main in the previous case, the first line what we needed was srotoshodhana sukshma guna in the initial phase. And here, along with this srotoshodhana, the medicines what we use should be able to reduce this medas. And how it is possible? The reduction of medas is possible by chedana as well as lekhana properties. So what medicine we can use here? In the initial phase, you can just, we can select this medicine, this Rasa Sindhura with Annabhedi Sindhura is another option. Because Annabhedi Sindhura or Kasisa Bhasma has got more of, again, has got a Srotoshodhana, as well as it has got properties like this Chedana as well as Medana, this Lekhana. So by adding this Rasa Sindhura with Annabhedi Sindhura in the equal dose, with the anupanas like honey, in the it can contribute more to the healing part. Or we can select another option, like if it is in the nadi vrana stage. The first one is, the first combination I have mentioned is in the pitaka stage. If the patient is approached to us in the pitaka stage, we can select this option as this Rasa Sindhura with Annabhedi Sindhura. If the patient is approached us with the nadi vrana stage, there we have to follow the properties as this shodhana as well as sravana. So if it is in the pure vrana or shuddha vrana, we can directly go for this dropana. So this then another apt combination can be either with the Rasa Sindhura with maybe 125 or 200 milligram or 1 or 2 capsule with 1 or 2 grams of simple Madhusnuhi churna or Chopachini churna. Madhusnuhi is nothing but China power in Malayalam, or in the northern state it's called as, mostly it's more familiar in the name of Chopachini. So 200 milligram of Rasa Sindhura with 2 gram of this purified Madhusnuhi churna or Chopachini churna, or even Vaja churna also can be. Neeramushnam Vachayavam. So Vacha is an agraushadha for Lekhana therapy. So this Vacha can be substituted, can be added with Rasa Sindhura. Maybe Rasa Sindhura with Madhusnuhi churna 2 gram and 2 gram of Vacha churna with honey can be given. Otherwise, we can directly go for, if we need little more pranashodhanatva, we can go for this Rasa Sindhura with Gugulu Panchapala churna with honey. And there is otherwise we can consider this option as Rasa Sindhura with Tripala Gugulu. Tripala Gugulu and Gugulu Panchapala churna, there is no much difference with Tripala Gugulu and Gugulu Panchapala churna, except in case of Gugulu Panchapala churna, there is Truti is and extra. Tok and Truti is extra in case of Gugulu Panchapala churna. The combination is different. Probably the better option will be the Gugulu Panchapala churna, because Gugulu has got Panchapala, that is 5 times in quantity is there in Gugulu Panchapala. We know the property of Gugulu, that is Chedana, Lekhana and Medohara. So this Gugulu Panchapala with Rasa Sindhura would be a better option in the Ropana phase, in the Vrana Shodhana phase. And if it is needed only in the Vrana Ropana, we can directly work with the Rasa Sindhura as well as Mutusmuhi Churna and Vaja Churna. Then the Kanmada. The another option is this Kanmada Bhasma or Shilajit Bhasma with warm water. These are the common medicines what we can make utilized. Not only in this kind of hydradenitis, whatever may be, the same can be utilized in the different kinds of prameha pitaka also. The same line will be effective in the treatment of prameha pitaka. Not only in deep-rooted, all kind of deep-rooted granthi or pitaka or nadi vrana, we can use this kind of combination. Now we will see another interesting trick. So Emil, 35 years, came to the OP with complaints of hoarseness of voice, lethargy, and severe hair fall since 1 year. He was on tablet levothyroxine 100 mcg since 1 year. On examination, palpable non-tender nodule on both sides of the trachea was visible. And on examining, the most common symptom of hypothyroidism, that is delayed deep tendon reflex. It is quite evident, even without any lab investigation, even without investigating TSH, we can diagnose this hypothyroidism by examining a simple reflex, that is DDTR, that is delayed deep tendon reflex. You can just Google that, what is how to elicit DDTR. It can be followed. It can be make you a routine in our clinic itself, even without the TSH level, investigating TSH level. We can get an idea regarding the hypothyroidism or thyroid level of the patient. So the diagnosis is hypothyroidism with hormone replacement. So as the symptoms, as if the patient is already in levothyroxine, it's our duty to test the TSH. On examination, you can just see the TSH as 100, above 100. It should be below 5, isn't it? So it is here, it's below, means it's above 100 here. And the other parameters like total cholesterol was 521 and LDL cholesterol was 460, but total LDL was 467. So what are the medicines, or what are the properties what we have here? Again, it should be there should be Deepana Pachana, as highly Agtimandya will be the basic tattva. So there should be a Pachana initially. It should not be this Deepana Pachana. Actually, it should be from Pachana Deepana. The first line should be Pachana. Once the Ama Pachana has been finished, then we have to switch to Deepana. It should be Kaphasamana as well as Vatanulomana. We may have to go for Shodhana as the TSH is this much. So what medicine, what herbomineral medicine we can use here? Usually, the best medicine in case of hypothyroidism is, in my little short experience, is nothing but the medicine called as Soimuknisinturam. It is quite effective with even if the patient is on levothyroxine or any kind of hormonal replacement, even if it is above 50 or even if something like 100 or higher side values. So we can use this Soimuknisinturam, again Google Panchavala Churnam, Anapethisinturam, etc. So you can see this here in this case, the Soimuknisinturam was given. I will explain what is Soimuknisinturam with a dose of 200 milligram with honey. Or Varanadi as well as Arthavillam Kashaya had been followed along with Kanchanara. Shodhita Tankana and Rasnadi Churna, application of Rasnadi Churna with Jambira Swarasa was applied locally. Shodhita Tankana along with the Rasnadi Churna. So now we will see what is Soimuknisinturam. This is a medicine. There are two preparations in the same medicine. So this is available in the form of capsule from this Ayurveda Shala. The ingredients are Parada, Gandhaka, and Lohachurna. Bhavana is done with Kumari Swarasa. And the indication is Kshayakasa and Agnimadhya, etc. So there are two references for this medicine. One is the Shargadhara Samhita in the name of Agninama Rasa. And another reference is from Sahasra Yoga, that is in the name of Swayam Bhasma. So the method of preparation is quite typical in this case. So that I will explain later. So this the indication is Kshayakasa and Agnimadhya. We know what is the specific the pathology happening in Kshayakasa. The Agnimadhya is at the peak, especially in case of Kshayakasa. So from this we can understand the potency of Deepana, the potency to to prevent or to treat the Agnimadhya because of the indication of the Kshayakasa. As being this is a drug, the method of preparation that I'll explain that now. Usually, just the Rasa and Gandhaka along with this Lohachurna will be done bhavana with Kumari Swarasa and kept in a Tamra Patra and placed in a Tamra Patra and kept in the sunlight. Being an exothermic reaction, if the sunlight is more, because of the heavy sunlight, high sunlight, and that mixture itself start burning after 2 or 3 hours. That's why it is called as Swayamagni. That becomes exposed to fire by itself. And once the entire portion has been burned, the fire becomes extinguished also by itself. This is a typical procedure called as, we can consider this as a Surya Puta. So, as this doesn't have much of Agni Samparka, like the other Kubipakwa Rasayana, etc., like Rasasindura, etc., the safety of we cannot assure with this medicine, and it may not be suitable for a long-term use. For short period, for a period of 2 or 3 weeks or 1 month, up to 1 month, we can use this quite safely, and then we have to withdraw it. Once the parameters are being under control, then we have to relieve this medicine. We have to shift this medicine to another. And the better known, and as the safety parameters, as this doesn't have much of Agni Samparka like the other medicines, better to consider this as a last resort. If all the other parameters, all the other our weapons are not effective, then we can go for this. And the method of preparation or the method of prescription also is little bit important. Usually we start with a smaller dose and do increase the dose little by little. But especially in my experience, always there is a concept of loading dose. So we can just start the dose in a higher, the medicine in a higher dose. And once the conditions are controlled, then better to taper it gradually. That would be the better one. The better issue, the better method. If we start with a smaller dose and increase it, there is a chance of adaptation. So to prevent this adaptation, always start with the loading dose and then taper the dose within a short period. Probably maximum time period what we can use in my experience is for 3 months. Within that period, the issues will be under control. So usually it can be used in severe Agnimadhya, etc. But usually better be specific in this kind of medicines. We can just see this. Previously it was 100 and reduced to 80. The total cholesterol level, which was 540, reduced to 310. LDL, which was 460, reduced to 250. You can just the entire problems were being reduced completely. Now we will see some of the most common medicine, that is Shankha, Pravala, and Esalabhasma. All these are indicated in GIT disorders. So where to specifically prescribe Shankhabhasma, where Pravala has to be prescribed, and where Yasadavasma has to be prescribed. Can we substitute Shankha with Pravala or Pravala with the Shankha? So that we will just see that. In case of Pravala and Shankha, we can consider this as a kind of non-systemic antacid. So why it is called, compared as non-systemic? There are two kinds of antacid in modern pharmacology. There is systemic antacid as well as non-systemic antacid. Systemic antacid, which are meant by, that is the group of medicines which has got a systemic absorption. In case the other group, non-systemic antacid, is which doesn't have an absorption in the systemic absorption. So that means through which form it is ingested, that will be excreted in the same form itself. There will not be any kind of transformation of the form, the chemical composition of the drug. So here also the same is happened. We know this calcium carbonate, both the Shankha and Pravala chemically are called as calcium carbonate. So how the reaction happens, in how the treatment or how the therapeutic efficacy happens. So we know that there is proton in the stomach. That is, protons are called as 2H plus, isn't it? So 2H plus, that's why it's called as this pantoprazole or omeprazole, etc. are called as proton pump inhibitor. That inhibits the production of protons, and which is responsible for the hyperacidity. So here, this calcium carbonate gets combined with the protons, that is 2H plus, which is situated in the stomach, and separates as Ca2 plus H2O2 and carbon dioxide, CO2, in the stomach. There are two phases of pharmaceutical efficacy. This happens in the stomach, and once this phase is over, this passes to the small intestine, where carbonic acid is the compound which is present in the small intestine. So the Ca2 plus gets combined with carbonic acid and being again converted as calcium carbonate itself, and then get excreted. So the calcium we are ingesting this in the form of calcium carbonate, and it's being excreted also in the form of calcium carbonate. That's why it is called as non-systemic antacid. So here the capsules, this calcium, this Shankha and Pravala, there is a peculiarity with AVS products. That's why I just wanted to know. So have you touched this Shankhabhasma with the tongue? If ever this plain Shankhabhasma has been touched with the tongue, definitely in the most cases that will be corrosive, highly corrosive, and we will feel some kind of burning sensation on the tongue. So what is the reason for that? There will be remnants of calcium oxide during the process of Bhasmikarana, this Marat. So the entire product may not have been converted to calcium carbonate. There will be some remnant calcium oxide also. This calcium oxide is highly corrosive. So that is creating the calcium the irritation or the corrosion of the tongue. So how can we tackle this? So we can just mix a drop of water, that is calcium, the Shankhabhasma. If it is mixed with 1 or 2 drops of water, that is calcium oxide plus 2H2O gives calcium hydroxide, which is an alkali, and again, which is more good for the hyperacidity. So what we are doing here is, once the entire process has been finished, again, we will just sprinkle some amount of water over this Shankhabhasma. And then again, once again, we will just heat. This is the method to prevent the corrosion produced due to the calcium oxide. So by sprinkling the water over this Shankhabhasma, the entire remnant, the calcium oxide will be converted as calcium hydroxide. And once the heating is done, that will be evaporated also. So such an issue will not be happening. So the kind of corrosion will not be happening with by doing this kind of procedures. This is why we are adopting the procedure before encapsulating the Shankhabhasma. So you can just do is CaO plus 2H2O, that is CaOH splice. So again, we know this, it's a chemical calcium carbonate. The anupanas are milk, kumari swarasa, and jeeraka churna, commonly anupanas. So it can make utilized in acid peptic disorder. This is Shitavirya. So you can use this acid peptic disorder in case of different kinds of vascular headaches, like trigeminal neuralgia or migraine, etc., to reduce the arterial dilatation. In case of osteoarthritis, it can be used as a natural calcium supplement. In case of different bleedings, again, as it reduces arterial dilatation, this becomes effective in different kinds of bleeding disorders. It may be this petechiae or any kind of what we say the HSP, enoxolin purpura, etc., or even menorrhagia, or even epistaxis, etc. Whatever may be, this can be used to arrest the bleeding also. And Shankhabhasma, again, the combination is same only. There is a difference between Shankhabhasma and Pravalabhasma. So the difference I will explain later. And now we will see the another one, that is Yashada. This is chemically, it's a zinc, and maybe the dose is 100 to 200 milligram. It can be given with either kshira or honey or guluji sattva, etc. are the common anupanas mentioned. This is the safest drug we can say in the entire Rasasastra, as zinc is the micronutrient of our body. And it has got wider range of application. It has got a very high efficacy in not only in case of this GID, it is quite effective in different kinds of neuropathy, in different kinds of liver disorders, especially the alcoholic liver disorders. This Yasadabhasma has got a property called as Yagritu Tejaka, as well as Sleshmakala Sankochaka. So different the medicines, the conditions like non-alcoholic, the alcoholic fatty liver, or even non-alcoholic alcohol also, by the property of this Sleshmakala Sankochaka. So it reduces the swelling of the area. And it is the chelating, the zinc is the chelating agent of copper poison. And thereby it can be utilized in different conditions like Wilson's disease, etc., where serum copper becomes increased. And the condition which I explained previously, to moisturize that area by mixing with any kind of ghratas like Satadoda Ghrata or Tittaga Ghrata, etc. So what are the difference? So Pravala as well as Shankha are Tridosha Samana, but Pravala is more Pittathika Tridosha Samana and Shankhavasma is Vadakaphadika Tridosha Samana. As Shankhavasma is more of, has got the properties like Deepana and Pachana and Agnivartaka, but Pravala doesn't have. This is the basic difference. So that's why we cannot substitute precisely with Pravala or Shankha together. And Yashada is typically, it is of Kapha Pitta Samana. And thereby we know that what is the Shula or Amla Shula produced due to Kapha and Pitta. It's nothing but Parinama Jola. Soyer Nidane Prabhupite, Vayu Sannihidastatha, Kapha Pitta Samavritya, Shulakari Bhavedbali, Bhukte Jiryati Yet Shulam, Karodi Parinamaja. The avarana of Kapha and Pitta. Probably that there is no need of going much deeper to know this avarana, the concept of avarana, to any kind of neurology or the diseases like MND, etc. The avarana is in its simplest form is observed in Parinama Shula. Kapha Pitta Samavritya Shulakari Bhavedbali. So here becomes this Yasada, the Parinama Shula becomes the typical indication of Yasada. This Shankhabhasma is a bit Lankhana, and Pravala and Yasada can be considered as Brahmana. And in case of Pravala and Shankha, there is a chance of a disease called as RAH, a side effect or adverse drug reaction, if it is used for a long time. RAS is called as rebound acid hypersecretion. So that means being this calcium neutralized the compounds, if we are using it regularly, the body itself will generate an immunity regarding the against the compound. So if it is being used for a longer time, later the efficacy, the therapeutic efficacy of these two seems to be reduced. So this is due to the phenomena called as RAS or rebound rebound acid hypersecretion. This is quite common in persons who has the habit of chewing betel leaves, as they are using this calcium, this lime as an adjuvant with that. So the same phenomena happens here also. So now we will see this different kinds of Gandhaka Prayoga. Gandhaka has got a wide range of action. And very sad to say, it is being used and very less. This is again, comparing in comparison with this Etiopathogenesis, this is also the safest group of drugs. But usually we consider this Gandhaka as something dangerous, but absolutely it is not like that. And there is a specific indication in Rasatarangani for this Gandhaka, that is Vidaram Nashayecheva. Vidara is nothing but it's a wound. And the wound here mentioned is nothing but is in a fissure. So fissure in ano. So this bleeding PR, especially due to the fissure, or in even whatever the other thing, even the fistula also, this becomes quite effective. So in acute phases of bleeding, especially this bleeding PR, this Gandhaka Rasayana becomes highly effective. Maybe in combination with Duspashakati or Google Panchabala or whatever it may be. Even along this simple Gandhaka Rasayana itself alone is sufficient. And the other conditions like different kinds of uterine tumors and even chronic RA, as well as this skin disease like psoriatic arthritis, etc. See, psoriatic arthritis, which has got a dual pathology, dual spectrum, isn't it? The dermatology as well as aromatology. So Gandhaka is the only one drug which has got indicated in both skin as well as joint. So Gayatri Asanodagi, in the case of skin disease, and Kogila like in case of as is been explained in case of arthritis also. So the conditions like psoriatic arthritis, this Gandhaka Rasayana becomes the most effective drugs, and also different kinds of fungal infections. So we'll see some fungal infections today. You can see these are all different kinds of fungal infections, which has been explained in many other classes also. And internal administration of Gandhaka, there are some other possibilities. One is Shodhita Gandhaka capsule, that is Gandhaka Rasayana. In the case of in AVS, it is available as Gandhaka Rasayana 7, Gandhaka Rasayana 14, and Gandhaka Rasayana 21. So Gandhaka Rasayana 7, that is 7 times Bhavana has been done. 14 times Bhavana done in case of Gandhaka Rasayana 14, and 21 times Bhavana. So it's 21 times Shodhana in case of Gandhaka Rasayana 21. This is an option. The another option, there is a Avaleha preparation called as Gandhaka Raja Rasayana. And there is another drug called as Valiyamuthusnuhi Rasayana, which contains Gandhaka as an ingredient. Both can be indicated in chronic, deep-rooted, recurring infections. There are some oils, external applications of Gandhaka. We'll just see. There are 3 oils with Gandhaka are being manufactured by Ayurveda. One is Adityapaga Taila, explained in Chakradatta, and Kimsukapatra Taila, which is a PNP medicine, and Gandhaka Taila, explained in Vaijaratnavali. So all these can be used in different kinds of fungal infections. Out of this, in my experience, this Adityapaga Taila is found to be more effective in different kinds of Tinea versicolor. Kimsugapatradi is more effective in kinds of tinea pedis as well as tinea capitis, etc. And Gandhaka Taila has got little more Chedana and Lekhana properties. So probably this is the disease like the lichen planus or hypertrophied lichen planus, etc. can be used as an option. And this Gandhaka Taila can be used as an option. There are some beliefs on Gandhaka. We believe mainly, there is a common belief that Gandhaka is the most potent drug. Yes, that's right. And it is the most reacting drug, many of us believe. Absolutely no. Gandhaka is a micronutrient, the sulfur is a micronutrient of our body. And it doesn't cause any such kind of reactions. And it needs strong pathyam. Absolutely, that also is a misconception. It is asked to avoid kagarashtaka, etc. But we hardly use the ingredients in kagarashtaka. Only caravel or something like that may be used now. And should not be taken in persons who possess allergy to sulfur drugs. Sulfur and sulfur are different. And it won't create any, usually it won't create any issues, even if it is given for the patient with sulfur drug allergy. And produces skin allergy when applied externally. No, that also, if the method of application is proper, it won't create any kind of allergy. Now we will just see the Arogyavardhini. We know these ingredients are, there's almost all the ingredients, all the most toxic ingredients are explained included in Arogyavardhini. Rasagandha lohabram, sulbha bhasma samamshakam, triphaladhiguna proktam, trigunam chashila chatu. So with the main ingredient is Kapurogini, and the other herbal ingredients are Rasa, Gandha, Loha, Abhra, Tambra. See, almost all these drugs are hepatotoxic, but still it has got an indication over liver disease. So there is a tendency, there is a the tendency that this being given in different kinds of skin and liver disorders blindly. But what I feel is this is really a hepatotoxic drug, but it is indicated in liver disease. So what we have to understand, there is a specific condition where we can prescribe this Arogyavardhini in liver disease. So what is that condition? That we will just see. So dose can be 250 to 500 milligram for adult case of adult, or 2 tablets. 1 tablet in children's age 5 to 18, 1 tablet 1 to 5. Different kinds of skin disease like this also can be used, this Arogyavardhini, which has got properties like Kleda Shoshana and Ruksha. Now, where we can use this Arogyavardhini in liver disease, that we will discuss with the help of a case. A case of 58-year-old male presented with complaints of generalized pruritus and clay color stool. These problems started with fever, malaise, and arthralgia and myalgia. Personal history: he was an alcoholic without much significant family history. What could be the diagnosis? On examination, blood investigation, the total bilirubin was 5.3, direct bilirubin was 3.6, and SGOT and SGPT was 336 and 728, which has been increased highly. On viral assay, the HAV becomes positive. That is, hepatitis A virus has been positive. So what does it indicate? Acute viral hepatitis. So what we can consider here is, as per my observation, any kind of infective liver disease is the only indication of Arogyavardhini in the normal liver disorders. It has got properties like Krimihara, Ruksha, Tikshna, and Ushna, as well as Pachana. So because of this kind of Ruksha, Tikshna, Krimihara properties, we can use this any kind of Aganduja variety of liver disorders, probably the kind of infective liver disorders. None of the other area, if it is used beyond much indication, it can lead to some complications. So this becomes the apt indication as per my observation, the acute any infective hepatitis. So now we will just have a conclusion. So these are the medicines we have discussed here: Rasa Sindhura and Hingula, then Soymagna Sindhura in hypothyroidism, Shankha Pravala and Yasdavasma, and different kinds of Gandhaka Prayoga, and finally the Arogya. I will just brush up once again. Better not to combine too much of formulations. If you are using one abominable drug, use that only. Don't mix together. Better to restrict for a short duration, maybe for a period of 6 weeks. Better to consider as a last resort if we are unsure about the ingredients and their probable reactions. Try to differentiate between ADR and adaptation. Whether our treatment is wrong, the symptoms has been worsened, is due to our wrong diagnosis or wrong treatment, is due or whether it is due to the medicine, and that is the adverse drug reaction. That should be differentiated properly. Need proper diagnosis. What I feel is Dosage alone cannot do wonders, and always logical incorporation of Dosage and Kashta gives optimum result. So once again, I express my sincere gratitude to the organizers, especially with the AVS Calcutta branch. So let me conclude, and I'll be happy to share and to answer in case of any of the queries. Thank you.
Dr. Dinesh, for an excellent presentation. Anybody has any doubts, please raise your doubts. Please raise your hand so that we can unmute you.
Dr. Dinesh, there's a question. Contraindications of contraindications of the Sindhura. Actually, there is no such contraindication. Only the thing is, there is a reference in Bhajaratnavali, Perugadhikara, that is Raso Vivardhe Vyadhi. So it is better to avoid in case of any the suspected renal conditions, because anytime it can lead to complications. That is the only restrictions, the contraindications what follow in case of giving this Sindhura, nothing else. And in the case of children, pediatric cases, etc., better not to, if at all we are giving, better not to give for a longer duration. Maybe for 1 or 2 weeks, we can continue. So the renal disease, as well as the suspected renal disease, and the conditions which can be progressed to a renal disease, means like some of the skin disease, skin lesions, etc., like some of the what we say, there are some syndromes called as staphylococcal infection, staphylococcal scalded skin syndrome, etc. 4S. So in such conditions, if we couldn't control it in during the proper time, it can lead to renal or the nephrosis, or means the necrosis, renal necrosis. And it is called as post-staphylococcal acute glomerulonephritis. So in such conditions, even though the lesions are on the skin, always it's better not to give in this kind of medicine, and there's some medicine during that kind of diseases, as we have to forecast the upcoming progression to the renal. Only that. like pathya to be followed while taking medicine prepared out of parada, vegetables and fruits to be avoided. Usually, I don't follow much of the kind of pathyas, etc. We can just use if it is given and if he is not terminally ill, we can the normal ichha pathya alone will be sufficient. As far as my experience is concerned, the pathyas are more related to the disease, not with the medicine. In case of disease, if some drugs or some food or some kind of regimens are contraindicated, then we have to abstain from those, but not with the medicines. This is what I feel. This is the dose of Gairika. Any direct reference to the class? Can we? There are references for administration of Gairika directly, but the dose, I think, as per my knowledge, it is 50 milligrams, something like the maximum dose is quarter to half or something. But I'm not sure that I have to refer that, and I will get back to you. Because these are all usually Gairika is not being practiced regularly by any of the physicians. So these are all becomes theoretical part, and I'm not much aware of that now. Let me refer and get back.
Hello, sir.
Hello. Sure.
Sir, ആരോഗ്യവർദ്ധിനി commonly കൊടുക്കുന്ന conditions ഒന്ന് പറഞ്ഞു തരാമോ?
ആരോഗ്യവർദ്ധിനി നോർമലി നമുക്ക് അറിയാം 2-3 കാര്യങ്ങളാണ് നമ്മൾ ശ്രദ്ധിക്കാനുള്ളത്. ഒന്ന്, ഇപ്പൊ നമ്മൾ പറഞ്ഞ ലിവർ ഡിസീസിൽ ഒരു സ്പെസിഫിക് ഇൻഡിക്കേഷൻ ഉണ്ട്, അത് ഞാൻ നേരത്തെ പറഞ്ഞു ഒരെണ്ണം. പിന്നെ രണ്ടാമത് നമുക്ക് കൊടുക്കാവുന്നത് സ്കിൻ ഡിസീസ് ആണ്. ആ സ്കിൻ ഡിസീസിൽ എപ്പോഴും ഒരു ക്ലേദപ്രധാനമായിട്ടുള്ള കണ്ടീഷൻ ആണെങ്കിൽ അത് പ്രത്യേകം നമുക്ക് കൊടുക്കാവുന്നതാണ്. അപ്പൊ ആരോഗ്യവർദ്ധിനി സാധാരണ ഒരു ക്ലേദ ശോഷണമാണ്, രൂക്ഷമാണ്, അതുപോലെ തന്നെ ഒരു പരിധി വരെ പാചനം കൂടിയത്. പിന്നെ അടുത്തത് ഒരു രസായനമായിട്ട് കൊടുക്കാം. അപ്പൊ പ്രത്യേകിച്ച് ഇതിന്റെ ഒരു ഇൻഡിക്കേഷൻ നോക്കിയാൽ അതിലൊരു വളരെ സ്പെസിഫിക് ആയിട്ടൊരു ലൈൻ ഉണ്ട്. ശരിക്കും നമ്മൾ പറയുമ്പോൾ രസഗന്ധക ലോഹാഭ്രം, ശുൽഭഭസ്മ സമാംശകം, ത്രിഫലാദിഗുണ പ്രോക്തം, ത്രിഗുണം ച ശിലാജതു ഒക്കെ കഴിഞ്ഞിട്ട് അവസാനം പറയുന്നുണ്ട് ജ്വര പഞ്ചദിനേ ജാതയെ. അതായത് ഒരിക്കലും കണ്ടിന്യൂസ് കംപ്ലീറ്റ് ആയിട്ട് നമുക്ക് ഈ പറഞ്ഞ പോലെ ഒരു ആമാവസ്ഥയിൽ അത് കൊടുക്കുക എന്നുള്ളതിനേക്കാൾ, ആ ഒരു അവസ്ഥയിൽ കൊടുക്കുന്നതിനേക്കാളും എപ്പോഴും ഒരു രസായനം എന്ന രീതിയിൽ കൊടുക്കുകയാണ് ഏറ്റവും ബെറ്റർ. ജ്വര പഞ്ചദിനേ ജാത 2 ഒപ്പീനിയൻ ഉണ്ട്. അത് ഫസ്റ്റ് ഫ്യൂ ഡേയ്സിൽ കൊടുക്കാം എന്നും പറയുന്നുണ്ട്, അതല്ല ആദ്യത്തെ 5 ദിവസം കഴിഞ്ഞിട്ടാണ് കൊടുക്കേണ്ടത് എന്നും പറയുന്നത്. പക്ഷേ എനിക്ക് തോന്നുന്നു അതിന്റെ മറ്റ് പ്രോപ്പർട്ടീസ് കൂടി വെച്ച് നോക്കുമ്പോൾ ഇനീഷ്യൽ ഫസ്റ്റ് ഫേസിൽ കൊടുക്കാതിരിക്കുകയാണ് ഏറ്റവും നല്ലത്. ഈ പഞ്ചദിനേ ജാത എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ ജ്വരം ഉണ്ടായിട്ട് 5 ദിവസം കഴിഞ്ഞതിന് ശേഷമുള്ള, അതായത് ഇനീഷ്യൽ ഫേസ് കഴിഞ്ഞിട്ട് മാത്രം കൊടുക്കാവുന്നതാണ്. അതായത് ക്രോണിക് ഡെബിലിറ്റേറ്റിംഗ് ഡിസോർഡേഴ്സ്. പിന്നെ ഇതൊക്കെയാണ് സാധിക്കാറുള്ളത്. പിന്നെ ബാക്കി ഡിപ്പെൻഡ്സ് അപ്പോൺ ദ കണ്ടീഷൻ. നമുക്കൊരു സ്പെസിഫിക് ആയിട്ട് പറയാൻ ഇത്രയൊക്കെ തന്നെയുള്ളൂ.
Okay, sir. Thank you.
Good evening, sir.
Yeah, good evening.
Sir, അർക്കക്ഷീര ശോധനം ചെയ്യാറുണ്ടോ സർ യൂഷ്വലി നമ്മൾ എവിടെയെങ്കിലും?
അർക്കക്ഷീരമായിട്ട് ഉപയോഗിക്കുമ്പോഴാണോ? എനിക്ക് തോന്നുന്നത് ആരോഗ്യരക്ഷാ കൽപ്പദ്രുമത്തിലാണ് അതിനൊരു റെഫറൻസ് പറയുന്നത്. കൽപ്പദ്രുമത്തിൽ റെഫറൻസ് പറയുന്നുണ്ട്. പക്ഷെ പൊതുവെ നോർമലി ഇതെല്ലാം തന്നെ ഒരു എക്സ്റ്റേണൽ തെറാപ്പീസ് ആയിട്ട് ഉപയോഗിക്കുമ്പോൾ ഇങ്ങനെ ശോധനം പതിവില്ല. ഇന്റേണലി എനിക്ക് അറിയില്ല, അതൊന്ന് നോക്കിയിട്ട് വേണം. കൽപ്പദ്രുമത്തിൽ റെഫറൻസ് ഉണ്ട്.
ഓക്കെ സർ റെഫർ ചെയ്യാം. സർ ഈ കൃമിദന്തത്തിനൊക്കെ പറയണ്ടല്ലോ, അപ്പം സാറിന്റെ ഒരു എക്സ്പീരിയൻസ് എങ്ങനെയാണ് ഈ ഒരു അർക്കക്ഷീരം വെച്ചിട്ട്? അർക്കക്ഷീരം മാത്രമാണോ?
അല്ല, അർക്കക്ഷീരം ഭാവനദ്രവ്യമായിട്ട് വരുന്ന കുറച്ച് മരുന്നുകളുണ്ട്, അത്രേ ഉള്ളൂ. അല്ലാതെ ആസ് സച്ച് അർക്കക്ഷീരത്തിന്റെ ഒരു യൂസ് എനിക്ക് അത് മുഴുവൻ അങ്ങനെ ഒരു എന്താ പറയുക എക്സ്പീരിയൻസ് ഇല്ല.
ഓക്കെ സർ, ഓക്കെ, താങ്ക് യു സർ.
Hello, sir.
Yeah, hello.
Can Arogyavarthin be given in children?
Definitely, it can be. From the age, probably from the age of 1 or 2, it can be given, provided the dose should be perfect, the anupanas should be perfect.
Yeah.
It can be given. There is no contraindication.
Yeah. Thank you, sir.
Anyone
Any
else
more
is there?
questions?
ഹലോ സാർ.
Yeah, hello.
സാർ ഒരു ചോദ്യം കൂടെ ഉണ്ട് സാർ. ഈ ശംഖഭസ്മം, പ്രവാളഭസ്മം ഹൈപ്പർ അസിഡിറ്റിയിൽ സാർ പറഞ്ഞിരുന്നല്ലോ. അതിന് സാറിന്റെ ഒരു എക്സ്പീരിയൻസിൽ നിന്ന് ഏറ്റവും ബെറ്റർ ആയിട്ടുള്ള സാർ കോമൺലി യൂസ് ചെയ്യുന്ന പാറ്റേൺ മെഡിസിൻസ് ഏതെങ്കിലും റെക്കമെൻഡ് ചെയ്യാനുണ്ടോ, അല്ലെങ്കിൽ സാർ ഇതിന്റെ ശംഖഭസ്മം പ്ലെയിൻ ആയിട്ടാണോ കൊടുക്കാറ് സാധാരണ പേഷ്യൻസ്?
പ്ലെയിൻ ആയിട്ട് ഞാൻ കഴിഞ്ഞിടത്തോളം ഞാൻ പേറ്റൻസ് ഈ കോമ്പിനേഷൻസ് ഞാൻ അത് ആദ്യം തന്നെ പറഞ്ഞു. കഴിഞ്ഞിടത്തോളം ഞാൻ കോമ്പിനേഷൻസ് യൂസ് ചെയ്യാറില്ല, സിംഗിൾ ഡ്രഗ് ആയിട്ട് തന്നെയാണ് യൂസ് ചെയ്യാറുള്ളത്. പിന്നെ ഹെർബൽ മെഡിസിൻസിന്റെ കൂടെ ചിലപ്പോൾ യൂസ് ചെയ്യാറുണ്ട്. അപ്പോൾ ഉദാഹരണമായിട്ട് അവിപത്തിയുടെ കൂടെ, അതല്ലെങ്കിൽ അഷ്ടചൂർണത്തിന്റെ കൂടെ, അങ്ങനെയെല്ലാം ചെറിയ ഡോസിൽ മിക്സ് ചെയ്യാറുണ്ടെന്നല്ലാതെ 2 or 3 മിനറൽസ് ഓർ ഹെർബോ മിനറൽ ഡ്രഗ്സ് ഞാൻ അങ്ങനെ മിക്സ് ചെയ്യാറില്ല. മാക്സിമം 2. ഉദാഹരണത്തിന് രസസിന്ദൂരത്തിന്റെ ഒപ്പം ചിലപ്പോൾ അന്നഭേദി സിന്ദൂരം മിക്സ് ചെയ്യാറുണ്ട്. അതല്ലെങ്കിൽ ചിലപ്പോൾ ശംഖഭസ്മം അല്ലെങ്കിൽ പ്രവാളഭസ്മം മിക്സ് ചെയ്യാറുണ്ട്. Sorry, I'm sorry. So usually I don't follow this kind of mixing. Sometimes the herbal medicines have been mixed with the mineral drugs like this, maybe with avipatti churna plus pravalabhasma, or avipatti churna plus shankhabhasma, or ashtajurna plus shankhabhasma, etc. In the combination of mineral drugs, usually I follow only in case of Rasa Sindhura, because of the properties of yoga wash. That too only 1 or 2 combinations only. So that is Rasa Sindhura with Annabhedi, or Rasa Sindhura with the Arogyavartini, Rasa Sindhura with Pravalabhasmam, or Rasa Sindhura with Abhragvasmam, etc. are being followed, but not more than 2.
The common dosage of Shankhabhasma, Pravalabhasma, can you say the common dosage you are following?
If you are making into combinations, that's what you are asking.
Yes, sir. If you are using as combination or as a single drug also.
No, if it is actually, if you are using, if it is being used as the Shamana Ushata with Avipatti Churna, if Avipatti Churna 5 grams, maybe with 500 milligram of Shankhabhasma or Pravalabhasma. 500 gram of Shankhabhasma and with 200 gram of Pravalabhasma. And if it is with Ashtajurna also same. A normal dose what we follow is 250 to 500 gram for this Shankhabhasma and 150 to 200 gram for this Pravalabhasma. Yeshadabhasma is also the same, 125 to 200 or 250. Not grams, sorry, milligram. These are the common dose.
Okay, sir. Thank you.
Anybody is there? Any more questions, please? Anybody's there? Please raise your question at the earliest, because we're going to conclude the session. Okay, thank you, Dr. Jayesh, for an excellent presentation.
Thank you.
And I think all the doctors would truly benefit from this section. So thank you very much once again. So good night all.
Thank you. Thank you, sir. Good night.